insurance reimbursement can vary a little bit. It depends on what insurance company that you have. Most of them cover about 50% on the average, but we've seen patients get up to 90%, even a whole 100% on insurance reimbursement. The trick is, though, you have to dive in deeper on the codes, which we'll provide for you. It's the same codes that typically other clinics will provide to the insurance company. We just give them to you in order to submit. But having those codes ready to go and being able to ask for them will give you a better and quicker answer on whether or not your insurance company is going to cover those services. We offer microcurrent point stimulation therapy, which is a direct current instead of an alternating current that typically TENS units work with. This allows the ability to go deeper into the skin, into the muscle, being able to relax it. We use it a lot for autonomic regulation, so if things are spiking too much, more of a fight or flight response, that input allows the body to transition more into a parasympathetic state. We also use it for scars. Within the scars, there's a lot of adhesions, so being able to go directly into those adhesions will allow the scar not only to break up, but change the skin tone. A lot of times it gets too dark, and by breaking it up, it actually shows a little bit lighter. And we also do various other treatments, whether it's related to GI dysfunction, headaches, chronic pain, and those kind of things. As far as getting in for treatments and other services, typically the average is about 2 to 2.5 weeks of wait time, depending on the location. My recommendation would be, if you're wanting to get in, call in advance and schedule out. That way you have opportunity to get your doctor's referral and get all the medical information that you need prior to your visit. Given that we currently don't have any waiting lists, it just typically takes about 2 to 2.5 weeks to get in. At Parr PT, we treat scars in 3 different ways. So the first one, we use microcurrent point stimulation, also known as the neural dolphin stim. What this does is that this current helps break up the adhesions within the scar, allowing it to expand more, to sit more loosely. That way it's not so tight. In addition to that, that helps with the coloration and the thickness of the scar. Number 2, we use more of a cross-friction massage, where we use our hands, our manual, in order to break up the adhesions also in the scar. So not only are we getting it from the device, but we're also using our hands. And the third one is applying different movements to help with expanding and getting more extensibility of the scar in that specific area. Our sports rehab is a little bit different. Obviously, we take into consideration typical strength and conditioning principles, rehab protocols depending on the injury. But the thing that we add to our sports program and our rehab is a lot of the vestibular training that we do for essentially spatial awareness and body awareness depending on the sport that you play. So we don't really have a protocol for all sports. We have to figure out, okay, what sport are you doing? And then we apply those vestibular training principles to that sport. So very sports specific. We still go through very similar progressions that we normally would do for chronic illness, because there are still fundamentals that most athletes are lacking that limit them from not only performance, but actually put them at higher risk for injury. And one of the biggest differences is that at Parr PT, we do take sports seriously. Each of our therapists actually have collegiate background in sports, in addition to the type of athletes we've actually worked with, from, X Games snowboarders, Olympic skiers, Olympic horse riders. We've even had some professional football players, baseball players. So understanding the way the body works from really high performance Olympic level all the way down to chronic illness really allows us to really focus on the very small detailed things that make a huge difference in sports performance. One of the conditions that we treat that's a little bit more complex is a condition called POTS, so postural orthostatic tachycardic syndrome. And with this condition, it's really related to a form of autonomic dysfunction that deals with heart rate regulation issues, blood pressure regulation issues. It could be things related to syncope, but there's a lot of things that are involved in basically tolerance, right? Activity tolerance. And when you have POTS, you can sit up from laying down and feel like you're going to pass out. You can be sitting and walk 10 feet to the kitchen and feel faint. And so there's a lot of receptors and sensors in the brain that respond to change in movement. And so when you're building programs and when you're treating POTS, you have to understand which receptors are being activated in which position as a way to understand what kind of movements can you start off with. So there are ways to gradually send information to the brain without overexciting the brain, because that's essentially what happens when you stand up and move or you pass out or anything like that. There was too much of a quick information to the brain, and the brain wasn't able to process it. So with our programs and our treatments, we focus on areas that are responsible for help regulating blood pressure, heart rate, and all that, in addition to gradually providing movements that allow your body to not react as hypersensitive and gradually flow through from laying down to sitting to standing to where you're allowed, you're able to get up and walk and do your, functional movements on a day-to-day basis. Now at Parr PT, each of our staff members go through vigorous training. So when I say vigorous, it's about a 8 to 12 month process of actual training. So the first 3 months is really built on educating regarding all these complex conditions, understanding the safety issues, the contraindications, indications, those kind of things, your typical stuff. But also understanding how to apply treatments before we even get into programming. So hand placement, more so when you get into secondary diagnosis, when you're related to POTS, dysautonomia, Chiari malformations, understanding what you can and can't do. So there's a really big load of information that goes on that first 3 months. And after that, it's the application. So we go through another 3 months of treating and understanding of not just treating solo, but they have to treat with a person who's already at like level 3 trained for 3 systems, which is, we have those 3 levels. So level 1 is getting all the information. Level 2 is being able to treat and understand that information and apply it in the way that you need to. And level 3 is when you're able to combine them all with understanding programs. So understanding the 450 movements that we have in our video library that go with chronic illness, that go with high performance athletes. So during that time, there's always mentorship over the course of that 8 to 12 months before someone is essentially cut free and been able to treat independently. So every single person on staff has to go through that. No one's allowed to treat any patient unless they have the qualifications to treat at a high level.